New South Wales has recorded more than 1,000 COVID cases, with health authorities warning the outbreak is still to reach its peak. But after 8 weeks in lockdown, residents of Greater Sydney have been promised a small reprieve. From mid-September, limited outdoor gatherings will be allowed for fully vaccinated adults. The news came on yet another day of record case numbers. And there's a warning that daily infections will go well above 1,000. Another 3 men have lost their lives to the disease, and the regional lockdown has been extended. The Premier says the state is on track to have 70% of over 16s fully vaccinated by mid-October, a fortnight earlier than expected. And she's urging businesses to start planning for a careful, staged reopening. Here's New South Wales political reporter Ashley Raper.
A modest gesture to provide some comfort in an escalating crisis.
We know that people coming together is what people miss the most.
As promised, new freedoms for hitting the 6 million vaccine target have been announced. They won't come into effect until September the 13th.
This is about rewarding the community in a way that is very safe.
People living outside the hotspots will be allowed to gather outdoors in groups of 5. If all adults are fully vaccinated and every person is in their LGA or within 5 kilometres of their home.
People are lacking a lot of human interaction, so anything that can bring people safely together is a positive.
I feel like if they want to do some kind of encouragement, it could be something more. Something that would benefit economically as well.
The rule change is different for those in the 12 local government areas of concern. Households will be allowed an extra hour outside for a recreational activity like a picnic, but only if the adults are fully vaccinated, they don't mix with other households and adhere to the current curfew and 5 kilometre rule.
That's nice, but I guess we still feel really restricted in this area.
It doesn't make any difference because I can't see my daughter. She's living in Annandale.
These steps are baby steps, recognising the serious situation we are in.
There are 1,029 new cases and 4 more deaths. All were men. 3 died in their homes in Western Sydney.
They were being cared for in out-of-hospital care, but I think any circumstance where there's the deaths, the usual process for health to do is review it.
More than 80% of today's cases were again in Sydney's west and southwest. There's no escaping the irony that the first easing of restrictions is announced on the first day new COVID cases top 1,000. But that serves to underline the fact that the statistic that matters the most to the government is now the vaccination rate. The state is now on target to hit the 70% fully vaccinated target early in mid-October.
We are already starting to work with industry stakeholders on how we can go back to safely open up for people who are vaccinated.
A clear message that those who don't get the jab could have harsher rules for longer. Ashley Raper, ABC News, Sydney.
The pressure on Sydney's hospitals isn't letting up, and the number of people needing in-home care for COVID is rising quickly. Many are frustrated, saying they've had little contact from New South Wales Health.
I've just got fatigue.
COVID's taking hold. Munira Nasaid doesn't just fear for her health.
I had previously had a brain tumour, so my immune system's really low. I'm not vaccinated.
But also for her kids. The youngest is just 1.
I just want to plan for them. I just want to know, like, day by day, what symptoms or signs I should be looking out for.
This is all Munira Nasaid has heard from New South Wales Health in the days after her family tested positive. She expects more than just a text.
We've had no one contact us to let us know what we should be doing.
There's a delay in public health getting in contact with the patients, so we're picking up the slack and, we just have to tell patients what to do, what to expect.
And doctors expect that to get worse.
1,000 cases today, so I can just see more phone calls, more stressed people, more people anxious.
GPs have told the ABC they're increasingly anxious about the coming weeks. The health department won't reveal how many patients it's caring for in the community. But here in the worst-hit West, more than 2,000 are expected by the end of this week.
Westmead Hospital's trying to ease the pressure by setting up a short stay unit for COVID sufferers.
Things are tricky. We're stretched, but we're working as hard as we can to keep the system as safe as possible.
Some people can deteriorate rapidly, so Dr. Skinner warns if you're breathless, it's time to call an ambulance.
We would far rather see someone early in the course of illness when we have the chance to intervene.
Advice that could save your life. Tim Swanston, ABC News, Sydney.
The Deputy Premier of New South Wales didn't hold back today. John Barilaro says the state's regions are on a knife's edge as case numbers continue to grow. He says a 2-week extension of the lockdown is needed to prevent an explosion in COVID infections.
It's not just grapes missing from this vineyard near Orange. The lockdown has crushed tourism in the Central West.
We understand it's necessary, but it's disappointing from a business point of view, particularly from a planning perspective.
All of regional New South Wales will stay in lockdown until at least September 10th.
We're sitting on a knife edge. It's a tinderbox ready to explode, and I do apologise to those communities that don't have cases today.
With our stretched system, we do not want to be fighting bushfires on multiple fronts.
That's little comfort to communities on the state's south coast. They haven't had a confirmed case of COVID-19 in more than a year.
People really conscientiously are doing the right thing. So I think that they are starting to get sick to death of being locked down when there's no cases in our local area.
In Broken Hill, a COVID-positive woman in her 40s who was isolating at home ended up in intensive care at the local hospital. Last night, she was transferred to Adelaide by the Royal Flying Doctor Service.
We did escalate that quickly, and the person was transferred really within a matter of 6 hours out to Adelaide. And as far as I'm aware, the patient is doing well.
The lockdown extension came as no surprise to people in Dubbo. Health authorities here are dealing with over 300 active cases, which is why there's such a focus on driving up vaccination rates.
There's no way in the world they'll be coming out in 2 weeks or 4 weeks. I think Dubbo and that area is probably aligned with Sydney in a sense in relation to when we get to 70% double dose.
I was expecting it to be announced for another month longer, honestly. The numbers coming through, they're just such big numbers for our small community.
The green shoots of recovery seem a long way off. Jake Lapham, ABC News, Dubbo.
For more on the New South Wales announcement today on easing the rules regarding coronavirus, we're joined by Ashley Raper in Sydney. Ashley, in the end, the Premier didn't have a lot of room to move when it came to easing restrictions.
Kirsten, the government acknowledged that what was announced today was small. The Premier's promise to provide at least one freedom for hitting that 6 million vaccine target was always about trying to incentivise people to get vaccinated and to give people a little bit of hope. Now, there were a number of options on the table which were perhaps more significant than what was announced today, including reopening some industries like hairdressing, beauty salons. But the Premier made it clear today that she wants most industries that have been impacted by the lockdown to reopen together, and that will be contingent on meeting the next milestone, that 70% vaccination target. And the government will release a roadmap in the coming weeks to outline how that plan will work reopening in October. But first things first, Kirsten, the plan for schools, and the government is set to outline how and when students will return to some sort of face-to-face learning in Term 4, and that'll be released tomorrow.
Political reporter Ashley Raper in Sydney.